Good morning, students. Now I am going to take endocrine glands presented by Dr.S. Krishnaveni, Assistant Professor of Zoology, A.D.M College for Women, Autonomous, Nagapattinam. Endocrine glands. There are two types of glands present in our body. They are exocrine glands and endocrine glands. Exocrine glands secrete products into ducts which empty into the body cavities or body surface. That is sweat, oil, mucus and digestive glands. Endocrine glands secrete products, hormones into bloodstream. Pituitary gland, thyroid, parathyroid, adrenal gland, pineal gland, other organs secrete hormones as a second function. Hypothalamus, thymus, pancreas, ovaries, testes, kidneys, stomach, liver, small intestine, skin, heart and placenta. This is the structure of endocrine gland. The pineal gland, hypothalamus, pituitary, they are located in the ventral surface of the brain. That is pituitary gland, anatomy and function. The pituitary gland is small and oval shape. It is located behind our nose near the underside of our brain. It is attached to the hypothalamus by a stalk-like structure. The hypothalamus is a small area of our brain. It is very important in controlling the balance of our bodily functions. It controls the release of hormones from the pituitary gland. The pituitary gland can be divided into two different parts, anterior pituitary and a posterior lobes. Anterior lobe. The anterior lobe of our pituitary gland is made up of several different types of cells that produce and release different types of hormones, including growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone and so on. First we can see growth hormone. Growth hormone regulates growth and physical development. It can stimulate growth in almost all of our tissues. Its primary targets are bones and muscles. Thyroid stimulating hormone. This hormone activates our thyroid gland to release thyroid hormones. Our thyroid gland and the hormones it produces are crucial for metabolism. Then adrenocorticotropic hormone. This hormone stimulates our adrenal gland to produce cortisol and other hormones. Follicle stimulating hormone. Follicle stimulating hormone is involved in estrogen secretion and the growth of egg cells in women. It is also important for sperm cell production in men. Luteinizing hormone. That is involved in the production of estrogen in women and testosterone in men. Prolactin helps women who are breastfeeding produce milk. Endorphins have pain relieving properties and are thought to be connected to the pleasure centers of the brain. Beta melanocyte stimulating hormone. This hormone helps to stimulate increase the pigmentation of our skin in response to exposure to ultraviolet radiation. Then growth hormone, so that is called as GH. Too much growth hormone causes a disease that is called acromegaly. In children, too much growth hormone causes excessive growth called gigantism. This hormone stimulates growth in childhood and plays a role in maintaining healthy muscles and bone and well-being in adults. It also affects fat distribution in the body. Adrenocorticotropic hormone, ACTH. This hormone stimulates the production of cortisol by the adrenal glands, small glands that sit on the top of the kidneys. Cortisol, a stress hormone, is needed for our survival. It helps maintain blood pressure and blood glucose levels and is produced in larger amounts when we are under stress, especially during illness, surgery and after injury. Too much ACTH, that is adrenocorticotropic hormone, will result in too much cortisol production. This is called Cushing syndrome or Cushing disease. Low ACTH will result in low cortisol called adrenal insufficiency. Thyroid stimulating hormone. This hormone stimulates the thyroid gland to produce thyroid hormones which regulate the body metabolism, energy balance, growth and nervous system activity. Too much TSH is rare and will cause hyperthyroidism. Too much thyroid hormone. Lack of TSH results in hypothyroidism, not enough thyroid hormones. Luteinizing hormone, LH. This hormone stimulates testosterone to production in men and egg release ovulation in women. Follicle stimulating hormone. This hormone promotes sperm production in men and stimulate the ovaries to produce estrogen and develop eggs in the women. LH and FSH together enable normal function of the ovaries and the testes. Problems with these hormones affect menstrual periods in women and fertility and the sexual function in both women and men. The following hormones are stored in the posterior back part of the pituitary gland: vasopressin and oxytocin. Vasopressin is called an antidiuretic hormone. It helps our body to conserve water and prevent dehydration. It conserves body water, reducing the amount of water loss in urine. Lack of ADH causes increased urination and thirst, a condition that is called diabetes insipidus. Oxytocin, this hormone causes milk to flow from the breast in breastfeeding women and may also help labor to progress. This hormone stimulates the release of breast milk. It also stimulates contraction of the uterus during labor. Oxytocin may also play an important role in human behavior and social interaction and may promote bonding between a mother and her child. Thyroid gland, this is the second endocrine gland. So, the thyroid gland is a butterfly-shaped gland that is present on the anterior side of the neck in front of the trachea. The gland weighs about 25 grams and has two lobes on either side of the trachea. Each of the lobes are cone-shaped, 5 cm long and 3 cm wide. In between these two lobes is a median mass of tissue called isthmus, which connect the two lobes. This is the structure of the thyroid gland: trachea, that is larynx, right thyroid gland, left thyroid gland. That is, these two glands are connected by isthmus, that is trachea. The internal structure of the thyroid gland consists of hollow spherical follicles that remain scattered through the structure. The walls of these follicles are composed of cuboidal epithelial cells, also known as follicular cells. These cells secrete a thyroid hormone in the form of a glycoprotein called thyroglobulin. The hormone is released in the form of an amber color sticky liquid called colloid. In addition to the follicular cells, the thyroid gland also contains parafollicular cells which produce calcitonin. The parafollicular cells are present within the follicular epithelium and do not form a separate mass with the connective tissue. The thyroid gland is highly vascular and is supplied with the arterial blood supply through the superior and the inferior thyroid arteries. Hormones of thyroid gland. The thyroid gland secretes 3 different hormones: triiodothyronine, thyroxine and calcitonin. Thyroid hormone, thyroxine and triiodothyronine. Thyroid hormone consists of 2 iodine containing hormones, thyroxine and triiodothyronine. Thyroxine is also known as T4 as it contains 4 atoms of iodine, whereas triiodothyronine is also called T3 as it contains 3 atoms of iodine. The follicular cells of the thyroid gland produce thyroxine as the major hormone, which is then converted to T3. Both the thyroxine and the triiodothyronine are composed of 2 tyrosine amino acid units linked together with the iodine atoms. The number of iodine atoms differ from between 2 hormones. The primary function or role of thyroid hormone to increase the basal metabolic rate and the heat production via glucose oxidation. Besides, it is also necessary for tissue growth and development, especially in the case of skeletal and nervous tissues. The level of thyroid hormone in the blood is regulated by the pituitary gland by the release of thyroid stimulating hormone. The regulation and the control of the release of thyroid hormone work by a negative feedback mechanism. Calcitonin is secreted by parafollicular cells or C cells of thyroid gland as a response to an increased level of calcium in the blood. However, the hormone is not given as much importance as the increased level of calcium in the blood does not have a physiological effect on the body. Calcitonin is given to patients suffering from osteoporosis as it has a bone sparing effect. Calcitonin acts on bones where it inhibits osteoclastic activity, decreasing the release of calcium into the blood. It also stimulates the uptake of calcium from the blood into the bone matrix. Functions of thyroid gland. The following are some of the functions of the thyroid gland. the most important function of the thyroid gland is to produce thyroid hormones that are essential for metabolic activities and growth. The thyroid hormone regulates the basal metabolic rate in the body by influencing glucose, fat and protein metabolism. The hormones are composed of iodine atoms, thus this also plays an essential role in iodine metabolism in the body. Calcitonin produced by the cyst cells of the thyroid gland regulates the level of calcium ions in the blood. The thyroid hormone plays a crucial role in the growth and development of the target organs in the body like the brain and the kidneys. Disease and disorders of thyroid gland. The disorders and the diseases associated with the thyroid gland are usually due to hypersecretion or hyposecretion of the hormones. The following are some of the disorders associated with thyroid gland and its secretions. First one is the Graves' disease. Graves' disease or Graves' thyroiditis is a condition caused due to the hypersecretion of thyroid hormone. The condition is more common in women than in men and can occur at any age, but it is common among individuals between 30 to 50 years. Graves' disease is an autoimmune condition in which the abnormal antibodies of the body are directed against the thyroid follicular cells. These unusual antibodies mimic the thyroid stimulating hormone of the pituitary gland and stimulate the thyroid gland to produce the hormone. Some of the common symptoms associated with these conditions are nervousness, elevated metabolism, sweating, weight loss, etc. Simple goiter. Simple goiter is a condition caused by the hyposecretion of thyroid hormone as a result of enlargement of the gland. Goiter is characterized by the formation of extra thyroid tissue which causes the enlargement of the gland. It is caused due to the persistent iodine deficiency which causes a relative lack of T3 and T4 in the body. In some cases, the increased size of the gland can cause damage to the adjacent tissues like esophagus and nerves. Cretinism is caused due to the hyposecretion of thyroid hormone in children. Clinical features of the condition are observed in the form of mental retardedness and a disproportionately sized body. The effect of the condition depends on the age and the physiological activity of the individual, but it is usually more severe in children than in adults. Cretinism might be caused due to the genetic deficiency of the thyroid gland or maternal factors like the lack of iodine. Thyroid tumor. Malignant tumors of the thyroid gland are rare, but benign tumors including single adenomas are fairly common. However, in the case of older adult, the tumor might become malignant. Even with a benign tumor, some might produce a large amount of hormones resulting in hypothyroidism. Thank you students.